let me start with a simple question. How many of you feel and have experienced that stress makes your thyroid condition worse? Oh, okay. This is why I'm here. Because my own background is that of a cardiologist, and I know very little about Graves' disease. But I have been studying stress and its manifestations for many, many years. To be exact, 40 years. So I started when I was 12. And when one looks at overall health and well-being, you can see that we view it as a three-legged stool. One leg being pharmaceuticals, second leg being surgery and procedures. Well, we're talking about a third leg, and that third leg is self-care. Many of us would not be here today were it not for the first two legs of the three-legged stool. It's certainly my case. About 15 or so years ago, this time of year, around Halloween, I was at home and walking to my shower with just a towel around myself. And earlier that day, I had worked through the house putting plastic across the air conditioning vents in the ceiling to keep away the drafts of winter. And I wasn't using Scotch tape because come spring it'd be very difficult to get off. I was using masking tape, and of course I knew it would be necessary to tack it back up as time went on. Well, walking through the kitchen, I looked up, and sure enough, it was peeling. And I thought to myself, I'll leave it alone. Don't stand on the chair, it's unstable. I didn't listen, stood on the chair, scooted out from under me. I went flying backwards, hitting my edge across the long edge of a butcher block table, towel flying off and me crashing to the floor. Well, my wife, having heard the noise, came in the room, seeing me naked on the floor. What are you doing there? So I tried to explain, don't worry, it's spasm, it'll go away. The pain didn't go away. And she said, should I call 911? I said, you'd better. She did. They came, but they came very quickly. But before that, she said, do you want to put on some underwear? So I did so, and they were carting me out, and I recognized this was serious. And if this was to be my last act in life, I wanted something meaningful to come out of this. So I called her closer. I said, hon, this is worse than childbirth. Well, in 1 millisecond, all compassion drained from her face. And she said, how would you know? Well, I had broken 4 ribs. They had punctured my lung. The lung had collapsed, and the pressure on that side would be conveyed to the other side. The condition is called a tension pneumothorax, and if the other side collapsed, that would be it. But they quickly diagnosed that at Leahy Clinic, put a tube in from the outside into my chest, sucked out the blood and fluid, and my life was saved. Now, 60 to 90% of visits to healthcare professionals they're stress related. And I'm going to be emphasizing that, and I'm certainly in this audience not going to underestimate the magnitude and the importance of drugs and surgery in the treatment of thyroid disease. But still, with 60 to 90% of visits in the healthcare and leading to healthcare professional visits, one certainly has to look at stress. Now, these are conditions that have been shown to be related to stress: hypertension, cardiac arrhythmias, chronic pain. Chronic pain is not caused by stress, but it's exacerbated by stress. Insomnia. How many of you have trouble sleeping from stress? side effects of chemotherapy in cancer, in AIDS, and certainly anxiety, hostility, depression, PMS, infertility, preparation for surgery and X-ray procedures. And from my cursory knowledge of thyroid disease, it's been mentioned as a factor, but certainly not one that has been highlighted and well researched. And that's what I want to speak to today, because there is no effective drug, there is no effective surgery that can deal with the side effects of stress. But we have within us an innate, inborn, natural response that's opposite to the stress response, and that's what I want to describe to you today. That's what we call the relaxation response. And after its description, with your permission and your accord, I will show you, should you so desire, and this would be voluntary, how to evoke the relaxation response, and then go on to speak to exciting new data that we've recently acquired, that when you evoke the relaxation response, there are genetic changes in your body that are opposite to those of stress. And those changes narrow down, one of the four major changes is one with oxidative phosphorylation, with oxidative metabolism, where the so-called ATP of your mitochondria actually is downgraded. And it was Larry and my feeling that it would be good for me to present these data, although soon not published yet, because it could open the avenue to consider the possibilities of perhaps research in the relaxation response at the genomic level and its possibility of working in thyroid disease. Okay, now, as I mentioned, I'm a cardiologist by training, and early in my career, I was noting that I was consistently over-medicating my patients. This was at the Thorndike Memorial Laboratory. And they'd come back with too low blood pressures because of the medication. They'd be hypotensive. And I wondered, now we're talking about years 65 to 67, 68, and I was wondering whether or not the measurement of blood pressure, the very measurement, might be leading to higher blood pressure, that the threat of a higher blood pressure would make a person anxious, and that person's blood pressure would go up accordingly. This was before the syndrome of white coat hypertension was defined. That is, the white coat of the physician, the white coat of a healthcare professional, of a nurse, would be threatening, the pressure would go up, and you'd get unduly high blood pressures. But I decided to return to Harvard Medical School, from which I had recently graduated, to see whether or not we couldn't come up with an animal. I'm sorry. It's an honor to be here today. Whether we couldn't come up, keep reminding me, Larry, please, that we couldn't come up with an animal model for stress-induced high blood pressure. And we work with squirrel monkeys. And we use the paradigms of Harvard's B.F. Skinner. He was a psychologist in the 50s and 60s, 40s, 50s, and 60s that firmly believed that you could shape one's actions, one's behaviors, by rewarding them. Brain was not important to him. Brain was a black box. But if you could reinforce a pigeon's pecking by rewarding it, by giving it a piece of corn, you can get that pigeon to peck away, blah, blah, blah. And in other words, he brought up his children believing that. I mean, where there wasn't holding the child or anything, but he would use behavior. Bizarre, but it was going on. So we reinforced high blood pressure in squirrel monkeys. We rewarded them. And soon we were able to reward them in a way that they would actually elevate their blood pressure, and we would reinforce that, and we kept doing that, they would die. And on autopsy, we saw many died of either renal disease, which is diagnostic, the kind of renal disease, renal vascular disease, of hypertension, or of strokes. So we felt this was an avenue to there could be a behavioral approach to hypertension. In the days, it was believed that virtually all hypertension was due to kidney disease, and that wasn't the case. Well, it proved not to be the case. So we reported that. Then some young people heard of these experiments, came to me and said, "Why are you fooling around with monkeys? We think we can effectively control our blood pressure. We practice Transcendental Meditation." Well, this was 67, it was 68, and in those days I was being told my career was in jeopardy by studying stress. And to study meditation was another universe, well off the radar. So I said no to these people, what was the 1967 equivalent of no way. They kept coming back, insisting upon being studied, and these were days before the so-called institutional review boards, the IRBs, so I didn't have to clear with anyone, I just did it. So what we did, but still I was cautious. We studied them only in the evening. We brought them in through side doors of Building C of the medical school and instrumented them with intravenous catheters, intra-arterial catheters, masks to collect their out-breath so we could measure their metabolism, oxygen consumption, measure their amount of carbon dioxide they were putting out, their carbon dioxide elimination, measure their respiratory rate through belts around their chest that could measure the in and out of respiration. We had electrodes on their scalp so we could measure their electroencephalogram, their brain waves, electrodes across their chest so we could measure their electrocardiogram. And we divided the experiment into 3 different periods: a pre-meditation, that is pre-period, a relaxation period, that is a meditation period, and a post-meditation relaxation period. The entire time, the subjects sat with their eyes closed with no movement. So they were constant. The only thing that was changing was the content of their thought. They meditated. First they thought regular thoughts, meditative thoughts, back to regular thoughts. So there was no decrease in both carbon dioxide elimination and oxygen consumption. The amount of energy their bodies were consuming was decreased 16 to 17%, and their respiratory rate, that is the rate of breathing, decreased some 14, 15 so from 14, 15 breaths per minute to 10, 11 breaths, some 25%. Well, what was going on? And their heart rate variability increased, and their blood pressure was being decreased too. So we didn't know what was going on here. One possibility was that they were falling asleep. And one looks at sleep, change in oxygen consumption in percent. With sleep, you see on a scale of hours, it decreases over 2 to 3 to 4 to 5 to 6 hours and then returns to normal, whereas the relaxation response occurred within minutes. Well, it wasn't sleep, and the brain waves were not those of sleep, but those of a different state where so-called theta waves were increased, not the pattern of sleep. The other mammalian condition that could lead to a decreased metabolism at rest is hibernation. So he said, might humans have some vestige of this within them, that decreasing their oxygen consumption because they've somehow learned how to plug into hibernation? How many of you think bears hibernate? Could I have a show of hands? Yeah, most of you do. Most of you, they don't. And my reason for bringing that is not to trick you, but out of my admiration for two brother investigators who measured whether bears were hibernating. And a good way to measure hibernation is rectal temperature, because a sleeping animal, decreases its rectal temperature, you and I, by 2 or 3 degrees. But a hibernating animal, if it were hibernating in this weather today, it would be 40 to 50 degrees. Well, these two guys entered caves of bears armed only with rectal thermometers. And this was going on in Alaska. And these were grizzly bears, tall, stinking, ferocious, top of the ecological tree creatures. And to the chagrin of these intrepid investigators, when they entered the caves of bears, they found that most of them spent the winter sleeping sitting up. So they had a very real logistic problem. But being bright, they knew that bears love sweetened fruit. So they went to the nearby Brooks U.S. Army Air Force Base Commissary, bought several quarts of maraschino cherries, put them in front of the bear, so when the bears leaned forward, they made their measurements. And they measured them till they awoke their last subject, which was understandably irate, chased them from the cave, and they escaped unharmed, but at which point they felt their debt to science was paid, and they reported their results in the medical literature. Well, under much less hazardous circumstances, we measured rectal temperature. In meditators, no change. So what in heavens was going on? In one of those wonderful serendipitous events, the room at Harvard Medical School in which we were doing these studies was the very room 60 years before that Walter B. Cannon had discovered the fight or flight response. He worked with cats, removed their adrenal glands, ground them up in a substance that he called superrenin, that is above the kidney, and injected it into other cats. And what did he find? Increased blood pressure, increased heart rate, increased rate of breathing, increased metabolism. The opposite of what we were finding, and this he labeled the fight or flight response. Any stressful situation evokes the fight or flight response. It could be a real one, a near accident. It could be, someone coming at you to hit you. But more often than that, it's the perception of something that will require behavioral change. The deception that you're going to run out of money and not pay your bill. The perception of illness in a child, in a loved one, that is a spouse, in a parent. The perception that your illness is getting worse. When you hear words like, "I'm sorry, you have breast cancer," pains that you would otherwise ignore will then be virtually every thought. Could that be a manifestation of the breast cancer? It could be deadlines or what have you. And when that is evoked, the adrenaline, noradrenaline, epinephrine, norepinephrine courses through the body, and this contributes in a major way to these conditions. And as you have noted, the thyroid metabolism and thyroid Graves' disease manifestations themselves. Now, we looked at the basic components that made up Transcendental Meditation, and we felt there were two basic ones after looking at others, but these were two. And these two basic steps necessary to evoke this response opposite to the fight or flight response are the repetition. That word, that could be a word, a sound, a prayer, a thought, a phrase, or a repetitive muscular activity. The others, when other thoughts intruded, you would repeat them and come back to the repetition. And what these two steps effectively do is to break the train of everyday thinking. To break the train of everyday thinking. So what we then did was spend several years reviewing the secular and religious literatures of the world to see whether or not these two steps hadn't been described before. And for us, it was a bit scary because this was new territory for us, because every single culture of humankind that had these two steps, normally within a religious context. The earliest we found was from the Hindu culture, the Upanishads, dating back to the 7th, 8th century BC, where it was written to achieve this communion with gods beyond you. Focus on your breathing, and on each out-breath repeat this word or sound or prayer or phrase from the Upanishads, from the Bhagavad Gita, or even the Vedas. Should other thoughts come to mind, disregard them and come back to the repetition. Next example came from Judaism, dating to the time of the Second Temple, which is roughly from the 4th, 5th century BC to the 1st century AD. In a school called Merkabalism, people would squat in a fetal posture, rock from heel to toe, and on each out-breath repeat the name of a magic seal, disregarding other thoughts when they came to mind. This work has been beautifully described by the Jewish scholar Gershom Scholem. In Christianity, prayers dating back almost to the time of Christ himself, and first cropping up amongst the Desert Fathers, hermits living north of Cairo in the 2nd, 3rd, and 4th centuries. What they would do would be kneel, focus on their breathing, and on each out-breath repeat the word Jesus as they experience love, disregarding the other thoughts. Thomas Merton has described this beautifully. A millennium later, an anonymous English monk wrote a work called The Cloud of Unknowing, where he described the same prayer for people who were overwhelmed by daily events. But ultimately, this was codified on Mount Athos in Greece, where to this day there are hallowed Greek Byzantine monasteries, and the instructions became kneel, focus on your breathing, and on each out-breath repeat the prayer Christe eleison, Lord Jesus Christ, have mercy on me, disregarding other thoughts when they came to mind. Exactly the same in Shintoism, Taoism, Confucianism, only the words are different. So we went back to the laboratory, brought in some bright Harvard medical student, Boston College, Boston University, Emerson College students, and gave them a modified form of Soto Zen Buddhism. That is, what they would do in a cross-legged position, count their out-breaths in magical numbers. Out-breath 1, magical number 1. Out-breath 2, magical number 2. Up to 10, back to 1 again, disregarding other thoughts. Well, we had these students, after instrumenting them in the same way we had instrumented the people with Transcendental Meditation, we gave them, just count your out-breaths, regular numbers, out-breath 1, 1, 2, 2, up to 10, back to 1 again. The experiment was a complete and inexorable failure. The bright students lost count, panicked, and that was the end of the experiment. So he said, oh, okay. Stay with the number 1. And when we did that, we found changes indistinguishable from those of Transcendental Meditation. And people have often said to me, isn't it wonderful you chose the number 1, the oneness of God, the oneness of the universe? And I said, well, it's in truth because Harvard medical students couldn't count to 10. Then what we did, this was now science. Here was something measurable, predictable, and reproducible. That's science. Something that measurability, predictability, reproducibility. And what we have done over the years is study various diseases that we felt were due to stress, and we have found that regular elicitation of the relaxation response can effectively treat these disorders. Many times in combination with drugs, many times in combination with procedures. But here was an anti-stress approach. So then what we recognized was that meditation was not the only way to evoke the relaxation response. Because if you look at oxygen consumption, respiratory rate, heart rate, slow brain waves, and blood pressure, you can see that so-called progressive relaxation. That is, you relax, flex the finger and relax it, flex your arm and relax it. Autogenic training, Zen and yoga, a pre-suggestion phase of hypnosis, Transcendental Meditation, and simple generic techniques, including repetitive prayer, all evoke the relaxation response. And we found that we could effectively treat many disorders this way. But still the question kept coming up, what is going on here? What is the possible mechanism for this? And John Hoffman passed away due to chronic myelogenous leukemia, but John did this study and published it in Science in 1982, namely the adrenaline, the epinephrine, the arousal due to the catecholamines of the body were actually increased when people did the relaxation response, which is exactly opposite to what we believed should be going on. And then it turns out, even though there was increase in these hormones, the adrenaline, noradrenaline, and what have you, the blood pressure and heart rate didn't change. So the responsivity to plasmin or epinephrine was decreased. There was a blocking effect, like an alpha or beta effect. Then other studies that evolved over the years as new technologies developed were doing functional brain mapping. Excuse me, I'm going to have to take this call. Hello? I'll have to call you back. Who it? Oh, Fred, I'll call you back. 2 for 2. Thanks, Fred. Bye. That was a call that I thought I couldn't not answer because it was a call. I thought it was a call from my wife, but it wasn't. So, so I could keep lecturing. Now, what Sarah did using fMRI was measure what was happening with brain metabolism within the brain. And fMRIs literally measure every single bit of activity in the brain by measuring its blood flow. And because in those years there weren't many people who could evoke the relaxation response well, we decided to use Seek meditators. And these people, we believe, could use a very simple two-step approach, that is a repetition and the disregard of other thoughts. It can do it within the donut of the fMRI. And so we brought these Sikh meditators in, had Sarah Lazar did, put them through the MRI at the Mass General, but just without it on, just showed them what it would be like as they were pushed in and pushed out. And then we had them evoke the relaxation response lying down at home. But in the background were the sounds of the clanking of the MRI. So they got familiar with that. And their typical form of, one of their typical forms of meditation was on the in-breath, they would say Sat Nam, his name. On the out-breath, Waheguru, to the glory of all that is the universe and what have you. Sat Nam, Waheguru. Sat Nam, Waheguru. Then we brought the people in, these subjects in, and this was the experiment. In the control period, they'd think regular thoughts. And because every thought's being measured, the control for that was animals, dog, cat, whale, what have you. That was the control period. And then the meditation period, Sat Nam, Waheguru, Sat Nam, Waheguru. And this was repeated, and we compared a second one, controlled to a meditation, and this is one subject, but this was consistent across virtually all subjects, where the meditation was compared to the control, and the probability of this being by chance is the p-values you see in the lower right-hand corner. Blues, the differences being in blue, p less than 10 to the minus 5, yellow 10 to the minus 10. These differences were 10 to the minus 23. In other words, enormous differences of regular thinking, and that evoked the relaxation response, and the amount of activity within the fMRI was markedly decreased. And what areas of the brain were being decreased were the amygdala and the hippocampus, the limbic system. These are the limbic system, the hippocampus. That's what controls metabolism. That's what controls heart rate, blood pressure, and what have you. So these differences were going on. So here, the brain was having these changes that reflected itself in what we had measured 10 or so years before with decreased metabolism of the body and heart rate and blood pressure. But still, we didn't have what was happening at the cellular level, and we decided to do genetic experiments. And these experiments were done in collaboration with the genomic laboratory at the Beth Israel Hospital, of which Dr. Tubia Lieberman is the chief. Now, this was the experiment. We took individuals who were matched for age, gender, race, height, weight, and marital status, and compared in Group M, long-term practitioners of a daily relaxation response, and compared them to controls who had never done so. These people averaged 7 years of doing the relaxation response regularly, and they used, that is, at least once a day or thereabouts, and these were the techniques used: Vipassana meditation, mantra meditation, mindfulness meditation, transcendental meditation, focusing on your breathing, 2 forms of yoga, Kripalu yoga, Kundalini yoga, and repetitive prayer. The average length of time them doing this was about 7 to 8 years. The range was 2 years to 19 years. So the controls did not do so. So this was a cross-sectional experiment. People doing something who were matched with people who were not doing this. Then we took the controls and taught them how to evoke the relaxation response, as I will show you later as time goes on. And then that was over 8 weeks of training. So this now became a second arm to the study, which was prospective, where the people were their own controls before versus after. And then we validated this amongst 16 other subjects. But what did we find? What did we first measure? We measured their white blood cells. And within the white blood cells, there are nuclei. And within those nuclei, you have the RNA and the DNA from which you can measure genomic activity, genomic expression. Genomic expression is another word for genomic activity. And we measured the activity in each one of their 50,000 respective genes. This was from the entire body. And we had no hypothesis going into this because we're measuring what's happening in a comparison between those who regularly evoke the relaxation response and those who don't. And here's how I'll give you just an idea of what the experiments look like. You see, across the top, we have N1, which are the controls. Then you have N2, which is those same people 8 weeks later. And then we have the M group. These are the long-term practitioners. Now, on the vertical axes, you'll have these bars which reflect genes that are statistically significantly different between N1 and N2 and N1 and M. Increased expression is red. Increased activity is red. Decreased activity is green. And you can see that when you compare N1 to M, they're statistically significantly different. And intermediary, generally speaking, 8 weeks of meditation, that is N1 to N2, is intermediary between the two. And we found this in various sets of genes. And let me just show you one, for example. This is gene set enrichment analyses. And this is, for example, amongst ribosomal proteins. And you can see N1 to M is strikingly different and less so, but in the same direction in N2. And then in ubiquitin-mediated proteolysis, just other genes that were cropping up. But let's talk about what did we find? These were genes that affected oxidative phosphorylation. That is, thyroid hormone kicks over oxidative phosphorylation. The hyperactivity of thyroidism is related to these same type of genes. And we found also nuclear messenger RNA splicing, ribosomal changes, primary metabolism, negative regulation of metabolism, regulation of apoptosis. Apoptosis is the aging of cells. The aging of the cells were slowed down. And a measure of aging is often what happens to the end of the chromosomes, the telomeres. Telomere aging activity was slowed down. And then, very importantly, a cascade of genes that determine that your response to infections, your response to immunologic challenge centered around NF-kappa B also changed, downgrading. So here, what we are showing, this work showed, is that when you evoke the relaxation response, genetic expression is active, is in a direction that's quieting the body down, with the stress response, inflammatory response, and apoptosis, and this is exactly the opposite directions that occur in a stress-related disorder such as PTSD. So, we all have this innate capacity which bridges the difference between mind and body. Larry will remember how difficult this was at the beginning when we started this work, because mind-body was woo-woo stuff. I mean, it was building on it was counter to the expression of René Descartes, who believed that there was a spirit on the one side, the body on the other, and because the church was demanding such differences, that was in the West, we developed this separation of mind and body. Then we came up with spectacular cures where the mind didn't matter. Take anti-tetanus toxin, you wouldn't get tetanus. That didn't require a mind-body effect. If you had diabetes and you were insulin dependent, take the insulin. It wouldn't cure the disease, but it could effectively treat it. And then in 1927, penicillin was discovered, 1929, and pneumonia could be cured. By gosh, that is remarkable. And now, on biblical standards, we can routinely cure blindness with cataract surgery, for example. We didn't need mind-body. And the whole mind-body concept was not allowed to develop because of this bias. But now, showing that the mind can affect the expression of your genes, that does away with the separation. So that Cartesian split of mind and body should no longer be accepted. And we have the steps to take advantage of this anti-stress capability within us, the relaxation response. And that's what I'm here, when Larry invited me to come here today, and I was delighted to accept in the hopes that this might lead to future work together. So with that, thank you. It's a pleasure to be here.